The next prep I'm going to be showing you is the arm prep. Just like last time, you want to grab your prep kit, place it on your prep stand, and open it up. You want to look at your materials, make sure everything's there. Because if the scrub and paint are not in your steel tray, you have to go get it and pour it in separately. Next, you want your gloves. You want to open these gloves. Open glove technique. Next, you take your towel and set it on the arm bar to catch any spilling or pulling. Take the patient's arm. Usually, or maybe you'll have an assistant, but if you're by yourself, you want to grab the patient's arm and pour. First you gotta pour your paint and pour your scrub. This time, you do not have to use the Q-tips because you're not cleaning out the belly button, you're not prepping that far down on the patient. But first you grab 2 wing sponges, dip them in the scrub, hold the patient up, and start prepping his hand. Gotta make sure to prep it really nice and good, and make sure you get in between the fingers, each finger separately, all the way down to the tourniquet. The tourniquet will be placed here on middle of the bicep. So you want to prep all the way up each side, all the way up to the tourniquet. And when you're discarding the wing sponges, you got to make sure to hold the patient up. Next, you take your towels. After you get done doing this 3 different times, you take your towels on the absorbent side and blot the patient. Which removes any excess scrub, and you just discard. Next, you take your sponges, and just with like the scrub, you got to make sure to get in between the fingers, all on the hand, the palm, the forearm, all the way down to the bicep, all the way up to the tourniquet. You also use this technique 3 different times. Once that is done, you set down the patient's arm, and the patient is now ready for surgery.